Assalamu alaikum everyone. Welcome to this introductory lecture on biostatistics for BSN Generic students. In this section, we will understand the fundamental concept of statistics and how they are applied in healthcare and nursing research. As future nurses, you will frequently encounter patient data, research findings, and hospital reports. Understanding biostatistics will help you interpret that information correctly and make evidence-based clinical decisions. Let's begin our journey into the world of numbers in healthcare. By the end of this lecture, you should be able to first understand the basic concept and importance of statistics and biostatistics. Second, difference between population and sample, parameter and statistics. Third, distinguish between descriptive and inferential statistics. And finally, identify and classify different types of variables. These concepts are the foundation of research methodology and evidence-based nursing practice. Biostatistics is a branch of statistics that applies statistical method to biological and health sciences. It helps us answer important healthcare questions such as what is the prevalence of a disease, is a treatment effective, what are the risk factors for certain conditions. In nursing practice, biostatistics supports clinical audits, infection control, monitoring, patients' outcome evaluation, and research studies. Simply put, biostatistics transforms raw data into meaningful information that improves patient care. Why do we study biostatistics? Research foundation, a basic requirement for conducting valid medical research. Scientific literacy, essential to read and understand medical literature and articles. Data management, critical for the organization, presentations, and interpretations of patient data. Now, let's understand two very important terms: population and sample. A population refers to the entire group of individuals we are interested in studying. For example, all BSN students in Pakistan or all diabetic patients in a hospital. A sample is a smaller group selected from the population for research purpose because studying an entire population is often expensive and time consuming. Researchers collect data from a sample and then generalize the findings to the population. Understanding these differences is essential for interpreting research correctly. A parameter is a numerical value that describes a characteristics of population. For example, the average blood pressure of a patient in a hospital. A statistic, on the other hand, describes a characteristics of a sample. For example, the average blood pressure of 100 selected patients in a research. We usually calculate statistics for samples and use them to estimate population parameter. Concept check. Identify the population and the sample in the following scenarios. A study of 300 households in Karachi. Population: all households in Karachi. Sample: the specific 300 household selected. Situation B. A study of all patients admitted to a specific hospital during the past year. Population: all patients admitted to the hospital. Not applicable. This is a census of the specific population described. Four scales of a measurement. A variable is any characteristics that varies with an individual or object. Variables are characteristics that can change or vary. In biostatistics, variables are mainly classified into quantitative variables and qualitative variables. Understanding variable types is important because it determines which statistical test we will use. Discrete variable represented by whole integer values, things we count: number of children in a family, number of accident, and number of patient in a hospital OPD. Continuous variable measured on a scale with potential for decimal, things we measure: height, weight, and blood pressure. Qualitative types of variables: nominal variables, scales used for labeling without quantitative values or order. Gender, categorized in male female, types of disease, TB, diabetes, blood type, blood group A, B, O, for etc. Ordinal variables, categories that can be ranked or ordered according to the criterion. Stage of disease: stage 1, 2, 3, pain severity mild, moderate, severe. Statistics can be divided into two main types: descriptive statistics and inferential statistics. Descriptive statistics summarize and present data in a meaningful way. Examples include mean, median, mode, percentage, tables, and graphs. For example, reporting that 60% of patients are females in descriptive statistics. Inferential statistics help us make conclusions or predictions about the population based on the sample data. This includes hypotheses, testing, p-values, confidence intervals, and regression analysis. Inferential statistics allows us to determine whether results are statistically significant or not. Assessment parameter or statistics. A researcher finds that the average weight of all newborn babies in Pakistan is 2.9 kg. In a survey of 500 university students, the average BMI was 24.6 kg per meter square. The Ministry of Health reports that 82% of all children under 5 in the country are vaccinated. The course evaluation: internal evaluation 60%, divided in 30% quiz and assessment, and midterm final evaluation 40%. Note: minimum 75% attendance required for final examination. Biostatistics is not just about numbers, it is the art of interpreting data to improve health and save lives. By understanding the types of variables, categorical and numerical, we can choose the correct analytical methods and uncover meaningful insight. In nursing and medical research, good statistical understanding leads to better clinical decision, improved patient outcomes, and stronger evidence-based practice. The recommended reading books. Thank you. To conclude, today we discussed the basic concept of biostatistics, population, sample parameter, and statistic, descriptive and inferential statistics types of variables. These are foundational concepts that will support you throughout your nursing education and research career. If you found this lecture helpful, please like, share, and subscribe